Aortic valve stenosis diagnosis. For many people, a routine checkup reveals the first sign of aortic valve stenosis. A doctor listening to your heart with a stethoscope may hear a whooshing sound or extra heartbeat that indicates a heart murmur. A heart murmur is often a sign of valve trouble, but not always. After a full exam and a review of your medical history, your doctor may order a few tests. They include 1. Echocardiogram. This imaging test uses sound waves to create a picture of your heart structure. 1. An echocardiogram can often tell whether your aortic valve has narrowed. 2. X-ray. This is another type of imaging test that uses electromagnetic energy beams to produce images of the inside of your chest. 2. It lets your doctor see whether your heart is enlarged, and if there's buildup on your aortic valve. 3. CT scan. This test combines multiple X-ray images to give your doctor provide a more detailed cross-section view of your heart. 4. MRI scan. This test uses a strong magnetic field to create images of your heart. 4. It can show the size of your aorta, which can help your doctor see how serious your condition is. 5. Electrocardiogram, EKG. This measures electrical activity in the heart. 5. It can help your doctor find out where there's been any heart failure, which may have been caused by aortic valve stenosis. 6. Exercise stress test. During the test, you walk quickly on a treadmill or ride a stationary bicycle to increase your heart rate. 6. If you don't have symptoms, seeing how your heart responds to exercise can help your doctor diagnose aortic valve stenosis, as well as other heart problems. 7. Cardiac catheterization. If there's insufficient evidence to confirm aortic valve stenosis, your doctor may recommend this procedure. 7. To do it, your doctor threads a thin, flexible tube into your arm to inject a dye, which shows up on an X-ray movie, giving a more detailed look at your heart's valves and chambers. Aortic valve stenosis treatment. If you don't have any symptoms and your heart is otherwise healthy, you may not need treatment. Your doctor might just keep tabs on your condition with regular checkups and testing. If you develop complications such as high blood pressure or arrhythmia, your doctor may prescribe medication to treat them. These may include 1. Blood pressure medications such as ACE inhibitors or beta blockers. 2. Drugs to manage an abnormal heart rhythm. 3. Diuretics to reduce fluid buildup. Medications for blood pressure or to control your heart rhythm won't reverse aortic valve stenosis, but they will help keep your heart as healthy as possible. When drugs aren't enough to keep things in check, you may need surgery to repair or replace your aortic valve. Aortic valve stenosis surgery. Even if you don't have symptoms, you could need a procedure to repair or replace a seriously damaged heart valve. Aortic valve replacement. This procedure is done with made of metal or with valve tissue from cows, pigs, or human donors. Your doctor may replace the valve using traditional open heart surgery, during which they make a cut down your chest wall and open your rib cage. Transcatheter aortic valve replacement. Another replacement option is a catheter procedure called transcatheter aortic valve replacement, TAVR. TAVR is less invasive, which means your surgeon uses much smaller cuts than with open heart surgery. People usually have an easier time recovering and have less discomfort with this procedure. Which option you and your doctor choose depends on the details of your specific case. Balloon valvuloplasty. This procedure is most often done in infants and kids with aortic valve stenosis. It's less effective for adults. In the procedure, a doctor guides a catheter, a long, flexible tube, through a blood vessel and into the heart. At the tip of the catheter is a deflated balloon. When the tip reaches the valve, the balloon is inflated, pushing open the stiff valve and stretching the cusps. Aortic valve repair. Doctors can also repair an aortic valve with surgery to separate cusps that have fused together. But in most cases, the valve needs to be replaced entirely.